everyone, and thank you so much for attending this webinar today, looking at the report that we've recently published on anti-racism in AHP education, building an inclusive environment. I'll start with just a bit of housekeeping. If you have any questions, there will be a Q&A session at the end of the webinar. Please could you put any questions in the Q&A function, and I will be able to see those and go through them at the end. You can use the chat as well if you would like to make any comments throughout the webinar. So thank you all for coming today. The report in question was released online on Tuesday, 11th of April, and we have seen some really great discussions online on social media since its release. So this webinar will allow for a bit of a deeper look into some of the case studies submitted to the report. So today we have two great speakers. First is Aydan Suphi, a senior lecturer in speech and language therapy at Birmingham City University. And secondly, Professor Marc Griffiths, Pro Vice Chancellor and Executive Dean at the University of the West of England. So thank you both for joining us today. First, I'm going to give a bit of background into the report and why we are doing this webinar. Okay, the webinar, the report was funded by Health Education England, which is now part of NHS England. And the aim of the report was to provide recommendations to the healthcare higher education sector on best practice in anti-racism in allied health education. So the report focused on 4 key areas of the learner journey. So these were recruitment and retention, university-based learning, practice-based learning, and finally transition to employment. Research for this report was carried out in 2 stages. So firstly, in August and September 2022, we carried out workshops with academic staff and wider stakeholders, covering the areas of recruitment, curriculum, and transition to employment. This was to kind of generate views on the key issues that students were facing in this area, to kind of scope out what we should be focusing on. We also conducted a workshop with students from the Council Student Leadership Programme. This was to understand the actual students' experience of these issues and what they felt it was most important to focus on. Secondly, to make up the main body of the report, we collected case studies from university staff across England. We chose 14 case studies to represent the 4 sections. Submissions were asked to cover the key issues facing students, what interventions were created, and then the outcomes of these interventions. So the kind of in detail recommendations can be found within the main report, but I wanted to give a bit of an overview of the kind of general recommendations that we've generated from the report. So firstly, for recruitment and retention, we found that it was really important to make sure that recruitment practices were flexible and innovative. So recruitment services should strive to use equitable processes for selection. For example, one university developed a bespoke video conferencing system to embed fair processes. However, under financial constraints, institutions can still implement key principles that are behind these sort of interventions. So areas such as recognising stereotype threats, reducing verbal load, and ensuring diversity of interviewers. It also found that community outreach is really important to understand the perception of the allied health professions within minority ethnic communities, and to ensure that recruitment processes are equitable according to all cultural values and behaviours. Finally, student safe spaces must be implemented to encourage retention and allow students an opportunity to raise concerns. For university-based learning, the key recommendations focused around diversifying and decolonising the curriculum. So universities must diversify and decolonise learning materials and teaching content. This can be co-created alongside students through working groups to advise on this content. and universities must also actively embed anti-racist practices into their pedagogy and teaching processes with adequate training for staff. Regarding practice-based learning, we found that student leadership development on placement should be encouraged as much as possible, and staff should create spaces for students to discuss their experiences. It's important that students have a safe space to speak up when they are away from their university on placement as well. And adequate staff training should be implemented for practice educators. Finally, for the transition to employment, universities should utilise scenario-based simulated learning to prepare students for situations that they might encounter when they are in employment. Staff should also encourage critical awareness and ensure that students are aware of concern escalation when they are away from their university. So that was an overview of the report and its recommendations. So I'm now going to pass over to Aydan to do a presentation on her contribution to the report from Birmingham City University. So over to you.
Thank you, Amelia. I'm just going to share my screen.
Sorry, Aydan, you're on mute.
Sorry about that, everyone. Okay, hopefully you can see that presentation. I'm going to talk about a couple of initiatives that we've put into place to start to address anti-racism within our curriculum, excuse me, on this BSc and MSc Speech and Language Therapy course at Birmingham City University. So the first one is around challenging discrimination in speech and language therapy practice. And this is part of our university-based practice, but applies to how students will manage witnessing discrimination and challenging it within their own practice. To give you a little bit of context into how this came about, well, firstly, I drew on my personal experiences of when I was working in speech and language therapy practice myself and witnessing racism or discriminatory practice or comments, and my reflections on how I and others managed this, you know, whether we challenged it, if we did, how we challenged it, what effects that had, or, you know, maybe there were times where we reflected that we wished we had challenged it when we hadn't. And so I kind of drew upon my experiences of this in planning this session. The other thing that was a driver for this session was the addition to the HCPC standards of conduct, performance and ethics. And this was recently added. You must challenge colleagues if you think they have discriminated against or are discriminating against service users, carers and colleagues. Previously, the guidance suggested that we should not discriminate, but there was nothing specific that suggested that we should be responsible for challenging. So I think this was a really important driver. The session is delivered, excuse me, in the context of a stream of teaching that happens throughout the course on cultural sensitivity. So in the BSc, there is a session in each year over the 3-year course, and it covers things such as our positioning, privilege and protected characteristics. We look at some of the models of cultural competence or cultural sensitivity and how we might apply those to practice. We talk about structural inequalities and addressing our biases. And so this session happens in the final year. So it's the kind of culmination of this stream. And the final driver really was learning about forum theatre, which originally was created by Bowl, who really kind of engaged the audience as participants in the theatre. And this was taken up by some medical education practitioners at Brett and McLean et al. Used it in the education of medicine and dentistry. And so it's like a really useful tool to use in teaching in AHP as well. So the session works like this. We run it usually in smallish groups. So the largest size we have is about 20 people. We establish some ground rules to begin with. And these are to do with confidentiality. So what is said in the session stays in the session, making people aware of the sensitivity of the content and making sure people, as far as possible, feel emotionally safe, inviting students to speak to us at the end of the session or to contact us later if there's anything that they're left with at the end of the session, and also reminders about sharing the space, that students with more privilege might feel more comfortable to speak in the session, and to be aware of that, to be aware of everyone having an opportunity to speak. We talk about the standards of proficiency to give a context for the session. And then one of 3 scenarios is played by 2 actors who work with me in running this session. And an example of one of the scenarios is 2 AHP colleagues are having lunch after one of them's carried out a home visit, and one of them starts to make some racist comments based on negative stereotypes, and does it in quite a light, jokey way. And then the scenario is paused and we facilitate discussion. So I'll ask students what they saw happening, what they heard happening, what thoughts and feelings that generated in them. And then we move on to look at what effect this might be having on the character who heard these comments. And then we move on to thinking problem solving about how to challenge this. So the students then direct the actors to about how they should proceed, what should be done, whether it should be challenged, how it should be challenged. We talk about the pros and cons of these. And then the actors do the next bit. We evaluate it, we go back and change it. Usually we manage 2 or 3 scenarios in the session, and in the later scenarios, if it feels appropriate, we might invite a student to come and replace an actor and actually play that part, so that they have a practice at challenging the comments that are made. It's generally very well received. I think that the comment that we receive most often is students say, I didn't realise it was our responsibility to challenge, that that was part of our professional responsibility, and it gives them some confidence, some strategies in doing that. And we also talk about what it feels like to be challenged, and what it feels like to witness discrimination, racism, and we talk about allyship in general as well. So that's that session. We have some reflection at the end, and students reflect on what they've learned, how they might apply this to practice. Yes, as I say, it's been quite well received, and we now run this session in the MSc programme as well. The second initiative is a more recent initiative, and this is to do with thinking about how we teach and use developmental norms in practice. So I'm sure colleagues are familiar with developmental norms, but just in case different professions use different terminology, what I mean by that is, at a certain age of development, children should be reaching this milestone. So in terms of speech and language, we might talk about, you know, how many words children should be putting together, or what language structures they should be using at a certain age. And I started thinking about this really in our discussion when really we started talking as a department and as a university about decolonising or de-imperialising the curriculum. And I know that obviously this forum reflects how different health professions have started to talk about that within our professional groups as well. I was really influenced by Mershon Pillai's work. He's a South African speech and language therapist and academic, and he wrote a piece about how some of our assessment practices were reductionist and essentialist, in that we were just looking at the deficit within the child and comparing these to these norms rather than looking at the whole picture of the child. And I was also influenced by other colleagues such as Warda Farah, who is a speech and language therapist and an activist, and she's spoken in lots of forums, including this podcast here. So, and the final thing that kind of made me think about this more is I'm currently working on my PhD. I'm looking at the experiences of parents who are living with social and economic disadvantage, and some of the participants' experiences of having their children go through developmental assessments, and they made sense of those as their children failing. And these were very young children, you know, 1-year-olds, 2-year-olds, and that really struck me as, my goodness, you know, what are we doing here? So this posed quite a dilemma, really, because developmental norms are used in practice. And so my dilemma was, how do I prepare students to work in these current practice, in the practice settings that they're going to be on placement in when they're qualified, and yet be starting to disrupt this accepted way of working, these developmental norms that I've used throughout my practice, that I've been teaching about. And so through discussion with colleagues, I decided to share the dilemma with students. We usually present developmental norms in the first years, like one of the early things that we teach. So I brought in a bit of discussion about this into the early sessions with first years. And I presented to them that they did need to know about these developmental norms. And so we were going to teach them and why they needed to know them, but also for them to think about the fact that this knowledge is constructed. It isn't a given. It's come from somewhere. And where has it come from? I also shared that this is an area that is, one that we're learning about as a profession, as academics. We're challenging ourselves on this, and the status quo may well be changing, and they may well be the people who do the changing as therapists of the future. And so I encourage them to bring some critical awareness to this, and encourage them to challenge us as well. To be thinking about, well, where does this knowledge come from? You know, when I looked into the history of developmental norms, it's very difficult to find where that data actually came from in many circumstances, and where we can find it, very often it is from white middle class populations. So having this critical lens, asking questions such as what assumptions are being made by this piece of literature, and in what other ways could we approach this? You know, could we look at the whole person with their motivations and abilities and desires? Are there other ways of assessing and evaluating children's development? So it's just in the initial stages. I have done this for 2 years now, two lots of runs of the curriculum. And I'm hoping to kind of add more to it as we as a staff group become kind of more well, more familiar and think about it more ourselves.
Great, thank you for that, Aydan. That was really, really insightful. So we'll move over to Mark's presentation now, and we will take any questions after that. As mentioned at the start, please feel free to put any questions in the Q&A box as we're going along, and we'll get to them at the end. So over to you, Mark.
Thank you very much, Amelia, and thank you, Aydan, for your presentation as well. So many similarities and interconnecting points. So, colleagues, I'm seeing different slides to. There we go. Hi, everyone. So my name is Marc Griffiths, and I am a health professional myself. I'm a radiographer by professional background. I lead a college of health science and society, as the name suggests. And I'm delighted and very, very privileged, actually, and grateful for the opportunity to actually share our case study, which was case number 9 from the report that Amelia mentioned at the start, the anti-racism in AHP education, building an inclusive environment. And what I hope to do over the next kind of 15 minutes or so is just to provide some real headlines of what our case involved, how it came around, some of the challenges, how we worked with partners in practice, and just kind of some of the next steps as well. I have a few slides. I will not be going through each word on each of the slides. I have provided my slides as a PDF that can be provided to all colleagues, as well as a copy of the report that was done for the sponsor for this work, which was at the time Health Education England, who have since become NHS England. So next slide, please. So just kind of highlight the report. 7 key themes came from the report that was published recently. And of all these several themes, what you'll find in the document is it relating to the 4 elements on the left-hand side of those bullet points there. I think what's important is the interconnections of each of the reports and each of these case studies. What was spoke about in the previous presentation just now, some of those interconnecting points and how an event at some time point can impact upon someone's potential and/or taking away an opportunity from them. If we think about this in the context of society and the real world, of course, we want to make sure that we have a diverse workforce that reflects society, right? But actually, sometimes when there are barriers and challenges that are there, either overtly or covertly, that has a detrimental effect. So what we did at the University of West England, Bristol, was to design a piece of work that looked at how we support our Black, Asian and minority ethnicized students in clinical practice, which could be community practice and also primary care, and look at some of the challenges and why so many of our Black and Asian minority ethnicity students were either having to repeat placements, having to repeat assessments, getting lower marks in assessments relating to their practice. We know this is the awarding gap, don't we? And what were some of the fundamental issues here? But rather than do this as a university focus, we asked partners in practice to help us. And that was the starting point. We asked for help. Next slide, please. So we know that I just mentioned our students are tomorrow's future workforce. So those of you that are students on this webinar today, your role and the place that you play in society is vital. And by workforce, I'm talking about health and social care. We need a diverse workforce. We need to make sure there's access to health and social care education beyond graduation as well. And we also need to make sure that certainly in places like Bristol, where I'm located, house prices are just so expensive. Actually locating here is a challenge for people coming in from outside of region, or if you happen to be from Bristol and you're trying to actually buy your own home and actually get on the property ladder as well. How do we do this with a diverse workforce? I'm going to say this openly because I think it's really important. I think as a university, we need to own the fact that a number of healthcare students, in particular 3 Black healthcare students who are all female, came to me one day and basically expressed some of their treatment on clinical practice. This is not me about, this isn't me trying to sort of portion based on practice. This is a whole system approach in terms of how we support. But they came to me because of some of the treatment that they received on practice. I'm going to use the word racism. I'm going to say actually there was microaggressions, and for some of them, over the duration of their placements, their confidence was knocked and had a detrimental impact upon their progression through their placement. No student, regardless of characteristics, should have experienced this. Every student should be able to go through their placement and be supported and come out a better person at the end of it. So we had a problem, a real problem, and it took the bravery of those 3 students to come and have a conversation with me to actually, on behalf of other students, also just themselves, promote and highlight the problems that were happening. So this was an opportunity. I saw it as an opportunity, as upsetting as it was for those students to be able to share. But what they did was they spoke up. They spoke up and they expressed their concerns for others coming through. These were yearly students. It allowed me, as a white privileged man, to be able to also explore my own biases. It also allowed us to actually think of critical race theory and our joint accountability as a university, working with partners to resolve challenges that some of our students were facing in practice. I'm not going to talk about intersectionality much today, but there's also examples of where it can be because of disability, it can be because of LGBTQ status, neurodiversity. There were elements of intersectionality as well, which also impacted, which just compounded the problem. Next slide, please. So we work together as a system. So as an integrated care system on ICS, working with a multitude of different NHS partners, a couple of charities as well. I'm working with Health Education England, who sponsored the work in terms of finances. We basically developed and designed a pathway of work that looked to not promoting how we best support our students, but actually really looked at our own processes, both in practice and in university, for calling out, speaking up, and supporting staff and students in terms of racism and acts of microaggressions within the placement where they happen to be as well. This was also about an opportunity to create promoting a culture of inclusion, and also look at some of our unconscious and conscious bias and how we recruited both students onto our programs, how we, for example, had learning environments that had a diverse range of mannequins, for example, with different color skin tones and environments. These are all things that I thought we were good at, but actually on reflection, I'm not sure we were. And again, I'm being really open and honest here today. The funding from Health Education England provided a project manager. So I worked with a brilliant colleague who did the majority of the work in this space. They were fantastic. It led to some education and training for people in practice and university. It also led to artifacts, and this, I'll show you what I mean by that in a moment. And also we did an end of event evaluation final report that I mentioned earlier on. Next slide, please. So Project AIM was there to actually improve education outcomes and support for our Black, Asian and minority ethnic students and staff actually. Particularly curious to know why such a small number of graduates from our university were also then going on to, or not going on to rather, CPD and lifelong learning. If you look at something called the RES data, that's WRES, which looks at the workforce and educational dimensions of all trusts across the country, you'll see profiles. And I was curious as to where in the pyramid of progression through the organisation of the NHS, where were minoritized colleagues. We also looked at barriers to education, equitable levels of support, looked at things in terms of opportunities, but really importantly, this is about co-creation of a programme of works that look to understand the problem and also work with our students on the programmes to really look at culture and to look at how we can sustain truly inclusive environments in the classroom and within clinical practice. We also looked across the Closing the Gap report and the update report that came out from UUK, and also, as I've already mentioned, the WRES report as well. Most importantly, and this is the question I kept in my head for the duration of the actual programme, how can we learn together without blame, without pointing the finger? How do we solve the challenge, or at least make a start on solving the challenge? Because you can't solve the challenge overnight. This has to be a system-wide form. And basically, how do we encourage our students to speak up and speak out, not at the end of their placement, but at the time when they are experiencing inferior and racist behaviours from within organisations, whether that's within my place of work in university or within practice. Next slide, please. There's partners. So these are very much obviously within the system of Bristol, where I work. We also linked with a couple of charities as well. For example, the LARE organisation, which is a charity-based organisation in Bristol that is particularly has particular expertise, particularly for Somalian communities in terms of living with trauma from either microaggressions and or racism, also the lived trauma of reopening those wounds when talking about one's experiences. So this is so important to understand lived trauma for people who have experienced racism. Next slide, please. So phase 1, phase 2, phase 3, just very quickly going, I'm just aware of time. Phase 1 was co-creation and how we looked at the project initiation document, getting sign off by the sponsor, looking at bringing partners and ourselves together with students, looking at, are we biased? Of course we are. Looking at how unconscious bias. So we did some base level training and education. Then we looked at creating a pledge, which was multi-organizational. I'll come to that in a moment. And then a strategy of how were we going to make sure that our policies, procedures and support for students was in place. And this is also about preparing students. I'm saying something maybe a bit controversial now, but it's also preparing students to say, in practice, you may get comment from patients about the color of your skin or the way in which your hair is braided. As awful as that sounds, preparing students for the real world, and I feel very, very sad that comments like that are said, but they are, that is the living world, it shouldn't happen. But preparing students for and creating that resilience and making sure that if comments like this does happen in practice or were to happen, it's about how that is challenged in a way which is causing no detriment to their placement, their experience or their opportunities. And then finally, I think it's the medical outcomes going forward. Next slide, please. Number of boxes there. Talks, I think, a bit more about how we did this. I've broken down the different sort of sections. We had subgroups looking at key themes, workshops. We had discussions, conversations. Now, most of this was done by teams because at the time we were just coming out of the pandemic. So that introduced more challenges, I think, into the actual project, but managed to work through it. Next slide, please. I've talked about this already. We used the rights model, which some of you may be aware of. It's a great model to use when looking at your own reflections in terms of the rules, integrity, good, hurt, trust, and success. If you're not familiar with this model, have a look at it. I think we managed to base a lot of our discussions around this in terms of doing no harm and doing the best of those that we actually support. Next slide, please. Here's the pledge. This pledge exists across, it's in my office. It's across the entire organization on various walls. I've got some pictures of this in a moment. We co-created this pledge with our students. This may not look like very much, but I can tell you, having this artifact, having this up within clinical environments and university, having credit card size versions of this as well, which students could carry with them. There's something about how we're taking a stance and how through those 6 points, we are looking at how we actually support our students and not tolerating racism or racial discrimination, whether it's in practice or in the academic environment. Next slide, please. Here's pictures, a bit blurry, but you can see where they existed, whether it's near the coffee machines, whether it's within study environments, on notice boards, in the local cafeteria, so on and so forth. And on the far right, you can see a card blown up quite big, so you can see that fits in a wallet, fits in your phone case, take it with you. And this can remind our students what they should be expecting in terms of protection in some cases, safety, assurances, confidence that we will take racism seriously with the organisation. Next slide, please. I love this journey map, and again, when you get the slides, have a look in a bit more detail. Part of it's cropped off at the top, get the general picture. We had some of our students in animation, so across the creatives school, spend some time with our healthcare students, Black, Asian, minoritized students. Not just those students, it was a wider group of students as well, looking at things like faith, for example, so looking at also in terms of neurodiverse students and their journey, their kind of flow, their river through the entire, and so much of this speaks to also the student leadership program. So much of this speaks to about actually it should be a place, university or any program, where you come out at the end, your finish point, where you flourish. Flourish is the word that I would use, and no harm should come to you either mentally or physically. Our job as universities, as civic-facing organisations working with whichever partners, is to make sure that we do really capture this in every aspect of your life. If they're true to be saying about what our value is in society, universities, this is what we should be doing. So actually bringing this to life through the voices of the students was really, really important. This has gone on to form some work about induction when you join us as a student, and really try to put in place in a visual format what it means to be a student at this university. Next slide, please. Impact of our student journey, it was very visual. The actual visual used, as I mentioned already there, it's used in practice, it's used for mentors, so on and so forth. Well, it's also used for where there's been lived trauma for students to actually say, where on the journey did this trauma occur? And sometimes it's before people, students join the program, because lived experience in secondary school, primary school, general society. It's about unlocking that and trying to work with students to provide support as well. So the report and support routes, we've really tried to enhance. So what started a project from 3 students having a conversation with me has very much led to us looking internally and externally at our policies, ways of support, and actually creating more speak up opportunities for students, academics, and those in mentors in practice. And ultimately, having an impact also on the awarding gap. Next slide, please. Lots of themes came out from it. Subgroups were created. I'll let you have a look at those when you get the slides. But I think my problem now became around how to kind of almost box and crocs this to make sure that we weren't going too far off, off the original mission. But this is the problem, right? In that basically something like, how do you put a cap on it? How do you say that's not important? And the one lessons that I'll take from this, one of the main key reflective kind of like points for myself was any project of this magnitude, be very clear from the onset about the objectives and aims, because actually the last thing you want to do is close someone down who wants to bring something in because it's important to them about this journey. So actually that bit that I will take from this and did take from this work in terms of lived experiences and case studies. Next slide, please. Again, I can talk to any of these. I think I've mentioned most of these boxes. If I haven't, I apologize. But I think one of the things we've also taken away from this project is about, and this was spoken about in the previous presentation by Aydan, was about the need to actually look at curricula, look at how we do assessments, the format, the style, so on and so forth. But I take that further as well, in terms of how we actually look at our simulation environments, how we look at immersive environments, how we create environments that reflect society. Next slide, please. Just some statements there. I thought it was really important. Just read these while I'm speaking. These were some of the important kind of comments that, exhausted trying to fit in. Some shouldn't have to fit in. Someone should be a student in their own right. Worried about placement outcome if I say something. Lonely. Only person of colour. Lack of diversity of staff and students. So again, what type of environments are we creating? Are we designing that truly speak to being inclusive? Next slide. So a lot of this work, as I mentioned before, pre, on arrival, during, we rebooted and particularly remapped our, based on the pledge, but we remapped what a student should expect and what we expect from practice for students. And you can see everything there from in terms of uniforms, appreciation of different, hair braiding, for example. Again, I go back to, I'll be very open about this, getting comments in practice about not appropriateness of different hairstyles or hair braiding. I mean, from a cultural perspective, it's just completely wrong and it needs calling out. So this was basically aimed at making sure that we were doing everything that we could, and a real you said, we did culture as well. Next slide, please. Staff feedback from practice and university was also similar in this, and this led us down the theme about having to think about how we provide mentorship support for staff, how we ready staff who may be going into practice to support students who have trauma from racism and racism acts, and how to best then support them. And basically, it does take education and training. It does take understanding, empathy, but it also takes bravery to be able to then take the next step and actually report, call out, and repair damage that's been done. And where appropriate, and this has happened a couple of times, remove a student from placement because it's unsafe for them and then replace them. I don't feel embarrassed saying that on this webinar, because actually, if that is truly the case, then that's what should happen. Make sure that student is not impacted. Next slide, please. Again, getting towards the end, I mentioned about mannequins. I mentioned about creating environments, making sure that we, for example, headscarves, Somalian population, even changing the colour from black to green to blend in with uniform is a really important touch to make sure that student is appreciated, respected in terms of culture, in terms of their positioning within a programme. We now have a number of mannequins of different colour skin tones. This is Victoria, our birthing mannequin. It's also about how you position environments and our duty of care, I think, as well. Next slide, please. Key themes by the subgroups. I mentioned there were several subgroups. I looked at an awful lot of things, and if I summarise them, there are the 5: preparation for practice, support groups and networks, where were they, who were they, raising concerns and speaking up, teaching and learning in terms of curricula, lived experience, and how we really evaluate that. And don't forget, this is also about how we make things better for the next generation of students coming through as well, isn't it? Next slide, please. Recommendations and potential next steps. There's lots in here. I'll pull out a couple of kind of key elements. The student journey mapping that we've done is now being taken into other programs across the university, which is brilliant. There shouldn't be a need for this work in the first place, but it's great that that's happened. Putting people back into the kind of their responsibility as mentors within practice, linking back in with the people plan and the articulation of development. I come back to some of my earlier points there. We've just received some funding to take this work back out across the complete wider southwest of England. So working with a multitude of different organisations, and cultivating allyship and greater identity for Black, Asian and minority ethnic students within healthcare programmes, and connecting with communities through outreach work as well. And the very last point there, I think about protected time for staff CPD in relation to EDI training. I came across a number of situations where it was really hard to understand where the EDI training was happening within practice and even in our own organisation as well. Next slide, please. I think I've mentioned most of this. Yeah, we can skip past that one. So I come to the conclusion. I draw back to the closing ethnicity degree awarding gaps 3 years on. If you haven't seen this report, it's really worth a read. So much interconnection between this report and what has been published by Chancellor Dean. I'd really encourage you to read this. This is the 3-year on. If you want to go back 3 years to the original one, I think what I've spoken about, and I think what Aydan's spoken about as well really speak to this report as well. But please, more work is needed. This doesn't stop. More work is needed in this space, and it's not about gathering data. It's about basically understanding the data and making sense and making environments that are safe for all students to flourish. I think that's the end of my presentation. It is. Thank you.
Thank you, Mark. That was really, really interesting. So I've got a question for you both, and then we'll go on to some audience questions. So I wanted to ask you, so the work that you've both done is amazing, and we can see that the impact that it's made. But some universities might be quite a lot earlier in their anti-racism journey. So what would your advice be for anyone who wants to kind of start making that change within their institution? What would you say is kind of the first step?
Would you like to go first, Aydan? Oh.
I can do, yes. I suppose I would say that any action is a start, and very often it does start with individuals making small changes, and it can feel very lonely, I think, being an individual making changes in a big organisation. But you know, if you hold fast, things do change over time, and I think then, you know, you have other people joining you. Find out who else is interested in the organisation. Where are the places you can join in? And obviously it really helps if you have buy-in from leadership. So who in the leadership is going to support you? Where can you get funding to support projects like, you know, like Mark's project? And I think just make a start.
Yeah, I support what's been said there and completely agree. Again, I come from a position of privilege. I lead a college, a large college, and someone actually did say to me, Mark, if you hadn't been in the position that you were in, would this be so easy? And I said, probably not. So actually having someone who's in a leadership position, and we're all leaders, but sometimes in an organisation, if you're a lecturer or if you are a nurse or kind of, you know, on the ground, it can be really hard to finding that allyship and actually getting leadership buy-in. I didn't have that problem, but I appreciate that's a position of privilege as well. But it's also sometimes taking the time out to listen and actually say nothing, do nothing at that moment in time, but actively listen to the experiences that have been played back to you.
Thank you both. Okay, so I'll go through a few of the audience questions now, if that's all right. So the first question says, have you had any issues with staff leadership or buy-in?
Shall I start with that one? I don't mind. So in short, yes, I think, again, if you haven't worked out now by now, I do, you know, tell it openly and honestly in terms of where things landed. And when I say some colleagues, both internally and externally, stated we don't have a problem here, or for example, they are students, it needs sorting out from within university, that was a shock to me and worried me actually. And this notion of the phrase is white fragility for people that are familiar with white fragility. A notion that the problem does not exist, a notion that it's someone else's problem, a notion that how can I possibly understand I'm not Asian, I'm not black, etc. But there were problems with buy-in, and people sometimes had, in their eyes, bigger challenges to resolve. And I'm not critical of that as such. You know, we've all got challenges in life, but something as systemic and as kind of embedded as what we've been talking about today. This is your workforce. These are our students. So there were challenges, and those took some robust conversations actually, and some honesty and mirror reflections. And I guess at the end of the day, some walked away, didn't want to be involved. Some reflected, and have now become the biggest allies actually for this work.
Yeah, I'd like to add my experience with that as somebody who isn't a manager in the department. And I think that I suppose my experience is that things can change over time, that sometimes the time has to be right in order to get buy-in. So, you know, when I first started this work, it did feel very lonely. It did feel like, you know, there were other priorities, and, you know, I had the sense that maybe people felt I was making a big deal out of nothing, and it was a lonely journey. But then, of course, you know, when George Floyd was murdered and the Black Lives Matter movement became more mainstream, and organisations were keen to start to kind of tackle racism, then the time was right, and people were coming on board and were much more open to it. And yes, you will always have those who are more interested in the work, more motivated by the work than others. But I also really believe in a critical mass. You know, slowly organisations will change, and those who can't fit into it will fall away. And so I just believe in just keeping positive and, you know, waiting for the time is right before, you know, leadership will kind of join the process, and then you can really make a difference, I think.
Thank you both. So I'll move on to the next question, which says, have these initiatives seen any other positive outcomes in terms of student retention or diversifying student recruitment?
Go ahead, Mark.
Do you want to go first, or shall I? Or
you go ahead. You go ahead.
Okay. They have in some programs, and I should have also mentioned at the very beginning that the work that I've spoken about today, it was AHP students and nursing and midwifery students as well. So even though the report focuses on the HP lens, and there were some particular differences within AHP, because actually a lot more of our AHPs go out into community practices, and actually you'd like to think a broader sense. There was a much more supportive environment. If I think back to my own day, that was many moons ago, but actually that was the case. Some of the student retention has improved. We've seen, I think what we've seen most of is students speaking up more and speaking about their experiences earlier within their placement. And that, for me, I guess, is a way of saying retention, because the last thing in the world that I want is for a student to only speak up after placement because fear of being marked lower or being failed, having to repeat, so on and so forth. So the retention has improved across most programs, some that haven't, where we're still seeing some struggles. It's definitely diversified. This project has definitely had a helping hand in making sure that in terms of our recruitment of students, the values-based and inclusion-based approach to student recruitment. So for example, open days. I know it sounds daft me saying this, but open days, making sure you have diverse environments, you know, in your open days. It's things like this which really make a difference. If you're first generation to go to university, for example, you might have kind of inbuilt kind of concerns anyway. If you are neurodiverse, you want to know what support. So why should race be any different in terms of the environments or the spaces? What will it be for me as a student in this environment? Who can I see that looks like me? Who can I see that's familiar to me in whatever characteristic that you present? And I think those are the things. So some of them are intangible, some of them much more tangible. The biggest thing that I need to sort out at the moment, though, my awarding gap across key programs where we've got gulfs, and I still don't know why. So that's the bit that I'm drilling down into to understand what's causing this. And personally, the place that I'm parking my bus at the moment and really drill down into is basically the types of assessments and how we present those assessments as well. So sorry, long answer there. It's a really complex field though, retention of students.
From my point of view, I think it's very difficult to tell because there are a number of different initiatives taking place, and so it would be very difficult to say that these initiatives that I've talked about have specifically led to retention. However, I have to say that a number of initiatives that are happening across the profession and the university have meant that our student groups are much more diverse than they used to be. And that, and I echo what Mark said as well, in that students are being more upfront about coming to us and telling us about their experiences, which is such a win, really. It's awful that it's happening, but yes, like Mark says, I would much rather know about it as it's happening so that we can do something about it, rather than finding out, you know, at the end of the course after they've finished the placement.
Thank you both. So I'll go, I think we've probably got time for one more question. So the next question that's come up says, how are you navigating challenging discrimination during placement with the potential impact that may have on the placement outcome? So the power that supervisors hold. Yeah, does that make sense to you guys? Yeah.
So I'd like to go first, Aydan.
Yeah, okay. We have brought in some placement educator training on our programme, or we have placement educator training anyway, and over the last 3 years or so, we've brought in specific training around quality, diversity and inclusion, where we start to talk about these issues. I suppose the difficulty that we have is that we can't make people attend this training. So the people who tend to come are those who are perhaps more motivated by it. But again, I'm hoping for this critical mass, that as our colleagues become more aware, that we can, you know, we can address it. And also, we often have peer placements through the work that we're doing around allyship. As peers become more aware of it, it's not always just down to the student themselves to raise it. And where we see an issue, we can do, you know, offer training and support to placement educators. I think it is really hard because we need placements. That's the other thing. And so we have to keep, you know, obviously they're very valuable colleagues and valuable partners in our course. And so it's that difficult balance, isn't it, between making sure our students are safe, making sure that we're offering training and keeping, you know, good relationships with our placements as well. So I think it is tricky, but I think that by addressing it, offering the training, sharing our own learning and journeys, I think change can be created.
And very quickly, I completely concur with what Aydan said there. It's also about good relationships, and through like PDRs, it's through your university placement kind of relationships, the honest feedback that you receive mid-placement, during placement, after placement. Power does exist, power dynamics, and the abuse of power and privilege does exist in all organizations. This is, you know, this is a known fact. It's about what's done to actually action that and mitigate as well. And having that honest conversation and calling it out when it needs called out as well. And any leader or any manager in any organization should be able to take seriously concerns raised. I know we're desperately out of time, Amelia, but my eyes are drawn to the last question, and I thought exactly the same today, if I'm honest with you, in terms of on the diversity panel today. Completely agree. If the person that worked with me was still working in the university where I'm working, unfortunately they moved back to South Africa, I would have absolutely asked Annette Garvey to join me today. Annette defines as a woman of colour, that's what she defines and identifies. Annette would have been here with me today to actually co-presented, because she was phenomenal as a project manager in this space, and I absolutely can't take any of the credit for what's happened in this work. I was privileged enough to be able to work alongside Annette for the duration of the programme, but it's a fair point, and thank you for the person who actually put that into the chat. It's an absolutely fair shout.
Thanks, Mark. Really good point raised there. So thank you everyone for coming. If you have any additional questions, feel free to send us an email. You can also DM us on social media as well. We will be sending out the PowerPoints following this webinar, and the recording as well will be available. So
thank you very much, everyone.
Thank you.
Thank you. Bye-bye.
Bye.